Last week, pharmacist Babayemi Oyekunle FPSN, chairman Pharmaceutical Society of Nigeria, shared his expertise on the policy gap and how to improve patient care in Nigeria. This week, we bring you the concluding part. Good evening. Welcome to Sound Health on Lagos Television. I am Olasumbo Modupe. The conversation begins after this break.
You hold me, you keep me safe, you are my world. Not every baby gets this chance.
Every 7 seconds, a mother or baby is lost to causes we could prevent. Not enough midwives, not enough medicine, not enough time. But this can change when we invest in science, in strong health systems, in equality, when we make the choice to support mothers and babies, when birthdays are moments of hope, not loss. We protect the future, because every healthy beginning means a hopeful future for us all.
Another impression about, because it's also a very important, this issue of fake and adulterated drug and drug abuse. What we are advocating and we have always said is that drugs should move through a guided or a controlled distribution systems. That is from the manufacturer or importer to wholesalers. Those wholesalers, they can be either in a coordinated center or any other place that is registered. And those ones will now in turn sell only to retailers, and those ones, the retailers will be, because in any retail pharmacy, there must be a pharmacist who will be there to make sure that before the drugs is handed over to the patient, he or she still counsel the patient about the drugs and how or why and when he should use those drugs.
Recently, the pharmacy practice was in the news about the non-implementation of the consultant's cadre for the practitioners. What's your take on this? Can you quickly bring us up to speed, and what is the way forward?
The essence of a consultant pharmacy is actually to get better outcome in treatment even of any patient, and that is what is recognized all over the world. So that is what we are saying. It's not that we want to create another cadre even for ourselves. It's only because we want, just all over the world, everything is about patient care and the outcome to their ailments, so that they get better outcomes, better treatment outcomes and all that. So that is why the cadre of pharmacy was created, to make sure that patients actually get better outcomes. And it is all over the world. It's entrenched in the healthcare delivery systems in developed and even developing countries. The issue of pharmacy consultant or consultant pharmacist, as some people wants to call it, is a global practice all over the world. It is not a Nigerian making. You know, it is not that Nigerian pharmacists just came up one day and said, okay, we want to become consultant pharmacists or pharmacist consultant. No, these are the practices that all over the world, that, you know, they are, it is entrenched in their healthcare delivery system. Even in Ghana, in Sierra Leone, in South Africa, in, you know, so many about over 20, 30 African countries, we have this cadre, consultant pharmacists. So it is not that we woke up one day and said, yes, we do want to be bearing the name consultant. No. And the truth also is this. Not every pharmacist is a consultant pharmacist. Before you can attain the cadre of consultant pharmacists, you must go to what we call a school for about 4 or 5 years, where after you have graduated as a pharmacist, just like what happens also with the medical doctors, you must go to this, we will do about 3-4 exams before you can now graduate as a consultant pharmacist. And what a consultant pharmacist does is actually higher than what an ordinary pharmacist can do. Don't let me use the word ordinary, or what a pharmacist can do. A consultant pharmacist can do much more, can intervene much more than a graduate pharmacist. So what came out was that the medics, or the physician, because that's actually their true name, the physicians came up and said they are the only one entitled to the word consultancy, or that can actually bear the word consultant in the hospital. But fortunately for us in this country, the Ministry of Establishment, the Federal Ministry of Establishment, have actually, gazetted and passed it out that now, because of the training of a cadre of pharmacists, they can now be called consultant pharmacists, because these are people that, by the body of knowledge they now encompass, by the things they have now learned, and by their training and even certificate, they can help the patient more in making sure that when they are giving drugs, the drugs will do what it is supposed to do. The patients will get better.
Okay.
The patients will be able to take the drugs when he or she is supposed to take it. The patient will not mix the drug with another food, with another drug. So many things, but not of time. So what came out is that we said the federal government have actually, accepted that, just as it is practiced all over the world, that there must be a cadre for pharmacist consultants.
Okay.
But unfortunately, we just found out that a group of physicians, because I don't want to say it is the enemy, because I respect even the doctors, because they are very also knowledgeable people.
Okay.
But a group of them decided, and because unfortunately they have hijacked the machinery of government to suit them, and because they are selfish, because all that we are saying is about the patient care and healthcare delivery. It is not about, personal aggrandizement. No.
Okay.
All that we are saying is that when patients are given drugs, they must be sure, and the outcome of those drugs they are giving must actually be what they are expecting.
All right.
And is that the patients will be better off. So it is not about us. It is actually about the patient. Let me round this up by saying this. And I'm saying this with every sense of responsibility. It is going to be a pity if drugs are prescribed and the patients get those drugs directly.
Okay, what excites you most about the future of pharmacy practice as well as patient care in Nigeria?
You see, let me tell you this, and it is the truth. Nigeria doctors, Nigerian pharmacists are one of the best trained professionals all over the world. That is why you see that when Nigerian pharmacists or even doctors, when they go abroad, it's easy to pass those corresponding, qualifying examinations in those places. So the future is very bright if we are able to just make sure that we utilize our manpower, the doctors, even pharmacists, especially the pharmacists, to the optimum. Let me explain. One of the problems we are having is that in Nigeria, which is not in every part of the world, even in developed countries, by the time you start moving a professional to administrative levels, that instead of what they have been trained for to become, the best physicians they should be, or the best pharmacists they should be, when you start posting all those people to go and be doing administration or doing one other things, we are depriving the patient, and that is the truth, especially for the physicians in Nigeria. Most of the brilliant, very brilliant physicians that we have, instead of them practicing, looking at the patient and diagnosing their problems and prescribing what they ought to take, we now push those doctors or physicians, as they ought to be called, into administrative cadres, so that we deprive the populace the expertise these people can offer. And that is a major problem we are having. The future, we are saying brain drain, but the ones that we even have here, instead of allowing them to actually be in practice, we have taken them out of practice and we have taken them. So it's going to be a problem. What I will advise the government to do is that if we want to manage our hospitals very well, let us have what is done all over the world and what was being done in this country before the era of Olikoye. Let's have people we call, hospital administrators. These ones are not medical doctors, they are not pharmacists, they are not radiographers, they are not nurses. All that they have gone to learn in the university or even in IAP schools is about how to administer, how to manage an hospital. Let's leave the professionals, the physicians, pharmacists, to actually concentrate in their area of specialty so that the patient will be better off. I laugh at this country when I see some of the best brains in medicine that are now being called upon or have been transferred to come and be doing one administrative work or the other. Whereas the patient, the general public, taxpayers that have been used to train them is at a waste, because these are very brilliant people. If government wants to make sure that the future of healthcare delivery system in Nigeria is guaranteed, we must do what is done in other climes. Have hospital administrators, make sure that the doctors, they make sure they see the patient, they diagnose the issue problems, they write prescriptions, pass it on to the pharmacists. Pharmacists look at the prescription, look at what the pharmaceutical care that ought to go with that prescription. Then now pass it on to the patient and all that. that's when we have a settled and assured future of healthcare delivery in Nigeria.
Are you looking at collaborating with other organizations and as well as other regulatory agencies?
We are an NGO, a professional group, and a profession, especially a responsible profession of like pharmacy, we are very responsible people, and everything that we have been taught is about how to take care and make sure that patients or clients get better. We've been engaging the government to make sure that these open drug markets, are no more, because this is not what takes place, what operates in other countries. And we've engaged government at different fora to make sure that the government has the willpower, because let me tell you, the open drug market is a political issue. It must take the willpower of a government to make sure that, because these are very, very rich individuals. These are also very influential individuals. You see, recently that the government, NAFDAC and PCN, they went to these open drug markets and closed them. You find out that within a few weeks, they have also now opened them. And even though they gave them some conditions they have to fulfill before they could start operating, but by and large, we find out that the status quo is back. Let me tell you what happened about 2 or 3 months ago, around that January, February, that these markets were closed. And actually happened during the time of God bless our memory, pharmacist Akunyili, Dora Akunyili, a past DG of NAFDAC. She too at one time has done that, but unfortunately it couldn't be sustained. So if what the PSN, Pharmaceutical Society of Nigeria, we are ready to collaborate and help the government with any help they want to desire, even from us, to make sure that these open drug markets are no more. We are not saying nobody should sell drugs. What we are saying is that, or maybe nobody should do business, but we are saying that one, drugs sales should not be taken as a business. It's a responsibility. Two, that only qualified professionals, pharmacists, should be in charge of any premise that is housing or storing or dispensing or giving out drugs. There must be a qualified pharmacist in charge, who will be what we call a superintendent pharmacist, that can be held responsible for what goes on in such places. We are saying that this is what is done all over the world, and that such things should begin to happen in Nigeria. Let drugs not be readily available to everybody. Let people be able to only buy their drugs if it is ethical drugs, when they have prescriptions. Let there not be illegal, drug outlets where people that are not qualified to be, there. That is where people who are not pharmacists and that are not supposed to be there are there now, controlling what goes on in that place.
All right.
Rounding up, we must not take drugs and selling of drugs as a business. It is not, if we take it as a business, we can do so many unethical things with it But when we take it as a responsibility, as a necessity that people have to take when they need them, not because we want to make profit. That is when, and that is what the training of a pharmacist is all about. It is not about making money, doing business. It is about getting happy when you see that your patients are taking a drug and it's better, and it's able to come to you and say, thank you for the drugs and the advice that you gave me. That is what we are talking about.
All right, Pharmacist Oyekunle, a major norm in Nigeria is medication sharing. We see that among families, among friends. I use a particular medication. Why not try it? If you were to advise Nigerians, what is one medical piece of advice that you give as we wrap up?
You see, this one is also very important. Yes, because we must be frank. All over the world, there is what we call responsible self-medication. Because now, we are in the technology age. People can go into the internet, they can go into the media and surf the net to discover drugs and their uses. But what we are saying, and I will advise every person, is that before you take any drug, get to your pharmacist. And they will do this even free of charge. I can assure you this. Get to a pharmacist. This drug that I want to take, can I take it? Because the pharmacist is the expert on drug. He or she will advise you on that drug, because people abuse a lot of drugs in Nigeria. And unfortunately, some of these drugs that they are using are also addictive. That is, when you start taking them, you will start depending on them. And there will also be what we call a craving to continue to take those drugs. But if you had gone to your pharmacist, and they are always available in your community, to ask, this drug that I even read on the internet, or this drug that one of my friends gave me, or this drug that one person used it when he had the same problem, can I take it? If you have gone to your pharmacist and you have been advised or you have been counseled, you will be better off. And in most cases, and I'm telling you the truth, these pharmacists, when you get to them and you just ask for drug counseling and advice, they will do it free of charge, because we've been doing that. Just because all that we are caring about, or all that we are about, and that's why we become the first point of call, is that we want our patient, our clients, we want the Nigerian populace to be better off, to get better when they are new, and to take the right drugs at the right time.
Responsible self-medication. Consult your pharmacist if you feel unwell. It is actually free of charge. Pharmacist Babayemi Oyekunle FPSN has assured you of the service that is free. This is where we say thank you on this segment. I have been speaking with pharmacist Babayemi Oyekunle FPSN, Chairman Pharmaceutical Society of Nigeria, Lagos State Chapter, on how to improve pharmacy practice and advance patient care in Nigeria. Thank you so much for your time once again on the show.
Thank you very much.
All right, Sound Health continues with trending health report from around the world. Please stay tuned. we say thank you on today's episode of Sound Health. Hope you've been enlightened about the pharmacy practice in Nigeria. For comments and inquiries, or you have topics you'd like us to treat, please send SMS to 0035826603 or follow us on social media at Lagos Television #Sound Health. Sound Health is a sound mind. Make healthy living your choice.